first point, CT imaging generates 3D images of an object from 2D X-ray images taken around a single axis of rotation. From this sentence, it means that multiple 2D X-ray projections are acquired as the X-ray tube rotates around the patient, forming a detailed 3D images of the anatomy, allowing accurate visualization of internal structure without overlapping. During scanning, an X-ray tube rotates around the patient, emitting either a fan or a cone-shaped beam, while detector measure the radiation from multiple angles. The reason as to why CT scan images has no overlapping is because the detector measures from different angles, the key difference between general X-ray and CT imaging. There are 5 basic components: X-ray tube, filter, collimator, detector array, and gantry. The first and the most important part is the X-ray tube. It produces the high energy X-ray photon needed for image acquisition. The X-ray tube must have a high heat capacity, allowing for continuous rotation around the patient in order to prevent overlapping of internal structure. Lastly, it uses rotating anode to dissipate heat, as producing high energy X-ray photons generally creates heat. This will dissipate them quicker, prolonging its life expectancy. Next is the filter. Filter is placed just outside of the X-ray tube window, helps shaping the X-ray intensity while also reducing the overall dose received by the patient, while also improving the image uniformity by reducing the beam hardening. Next is the collimator. Just like the filter, it also helps shapes and emits the X-ray beam, also reducing the overall dose received by the patient. Not only that, collimator also plays a role in improving image quality, as it also determines the slice thickness used for each examination. The next most important component, I would say, is the detector array, as it helps converting the X-ray photon into electrical signals. Detector also rotates around the patient just like the X-ray tube. Detector must have a high detection efficiency, allowing an improvement in image quality. Next, and also the last component, is the gantry. The gantry houses the X-ray tube, collimator, and the detector. The gantry moves from the superior part to the inferior part, or vice versa, depending on how the radiographer set up the room. And lastly, the gantry can be tilted for specialized studies or for certain examinations that positioning that the patient can handle.
Image acquisition in CT involves generating X-ray, detecting them after passing through the patient, and reconstructing cross-sectional image using computational algorithm. This process includes patient positioning, X-ray tube rotation, data collection from detectors, conversion to digital signal, and image reconstruction. Uh, In this figure, you can see how the process of image acquisition start from the generating X-ray until the image display. And next, for the image acquisition process, they have 6 processes of image acquisition in a CT scan. First, patient positioning. Second, X-ray generation. Third, data collection. And then detector conversion, image reconstruction, and lastly, image display. This is the process how the image acquisition is happen in the CT scan. And next, I want to explain more detail about the image acquisition process. First, the patient positioning process. The patient lies on a motorized table that moves through the gantry. Proper alignment ensure accurate anatomical coverage and minimize artifact. And then for the X-ray generation process, X-rays are produced in the CT scanner X-ray tube via Bremsstrahlung radiation. Voltage range typically between 80 to 140 kV, depending on diagnostic needs. And next, for the data collection process, as the X-ray tube rotates around the patient, detectors on the opposite side capture attenuated X-ray. Each rotation produces multiple projections from different angles. For the detector conversion process, detectors convert X-ray photons into electrical signals. Signals are digitized for computational processing. And lastly, for the image reconstruction algorithm, which is filter back projection or interactive reconstruction, transform raw projection data into cross-sectional image. Reconstruction produces slices that can be stacked into 3D volumes. That's all for the image recognition process. First clinical application of CT scan is thoracic imaging. We can use to detect lung disease such as pneumonia, tuberculosis, pulmonary embolism, and lung cancer. And next, for the cardiac CT, we can evaluate coronary artery disease, calcium scoring, and congenital heart defect. And it can also use in the mediastinal muscles, which is can differentiate lymphadenopathy, thymomas, or other chest lesion. And second, clinical application is musculoskeletal application. It can detect fracture, especially complex one, such as spine, pelvis, and facial bone. And then for the joint evaluation, it can be used to detect arthritis, infection, or prosthesis complication. For the bone tumor, it can differentiate benign versus malignant lesion. For the third clinical application of CT scan is neurological application. Stroke can be detected in the CT and also can quickly identify ischemic or hemorrhagic stroke and guiding urgent treatment. Head trauma such as detect skull fracture, intracranial bleeding, and brain swelling. And also it can be used in tumor evaluation, which is can assess brain tumor, metastasis, and treatment response. And for the fourth clinical application is vascular imaging. Aneurysm can be detected such as cerebral, aortic, or peripheral aneurysm. Vascular occlusion identify arterial stenosis, thrombosis, or embolism. For the pre-surgical planning, which is the map vessel for bypass or stent placement, can be used in vascular imaging. And lastly, for the clinical application is abdominal and pelvic imaging. We can use in cancer staging in the liver, pancreas, kidney, and colorectal. It also can be used in trauma cases, which is can detect intracranial bleeding, organ laceration, and bowel perforation. And lastly, for the urology and gynecology, it can be used to detect kidney stone, ovarian masses, and uterine abnormalities. That's all for the clinical application for the CT scan.
But before we went through about the latest technology in the CT scan that we use today, I'm going to give a brief history about how all of this even started. It all started back in 1963, where there's a physicist named Alan Comic, where he discovered a mathematical possibility of seeing through the interior of an object by using the transmission measurement knowledge. But we're gonna fast forward to 1970, where an engineer named Godfrey Hounsfield thought of the same question as Alan Comic, and by using the concept introduced by Alan Comic, he started to develop a contraction to test out his theory. And after that, the story continues on. Next, I'm going to give a brief history about all the major advancements received by the CT scan throughout the years. Firstly, we got electron beam CT, then there's spiral CT, next we got multi-detector CT, after that is 64 slices CT, and then we got dual source CT. All of this just improve the radiograph produced by the CT scan. But for the next one, the dual energy CT, what does it do exactly is that it improve the capability of a CT scan to differentiate between two anatomical structure way better. After that, we just get 256 or 320 slices CT, which improve the resolution of the CT further than the 64 slices CT. And finally, we got here is the iterative kernel CT, where it improved the reconstruction of the CT scan radiograph without the need for the us radiographer to increase the radiation dose received by the patient. Now the latest technology discovered in CT scan, well actually the most recent advancement discovered in CT was discovered way back in 2021, and that advancement is known as photon counting CT, or PCCT for short. So what is it? Well, PCCT function by directly convert an X-ray photon into an electrical signal. But what does it actually do? What does it even improve from the older CT scan model? Well, the older CT scan model used a scintillator detector that went through two-step process of photon conversion. It convert photon into visible light and then into electrical signal. Because of this, some information may lost during this conversion process. But the PCCT or photon counting CT reduce or even erase all of that problem and improve the diagnostic accuracy of a CT radiograph. Now, there are actually a lot of advantages that came in a CT scan. Well, firstly, it gives out a higher image detail compared to the general radiography. And then it is quick and non-invasive, unlike a surgical procedure. Next, it is very versatile due to its wide range of scannable anatomical structure. Almost all anatomical structure inside our body could be scanned by a CT scan. After that, we actually often use it to gut biopsy due to how versatile and easy to use it is. And finally, unlike the general radiography, because of its higher image detail, it is more useful in detecting more complex conditions such as stroke, cancer, and heart disease. But then, of course, with all that advantages, there's still some limitation that come with this machine. Well, first out, because it give out a higher image detail, it also give out a higher radiation dose to the patient compared with the general radiography. And then it's also higher cost compared to general radiography, not just in term of the pricing, the purchase price itself, but also the maintenance cost is higher because you didn't just need to take care of the machine, but also the power injector that also came in the CT scan machine. Next, because of the fact that some CT scan procedure require a contrast media, it come in with a possibility that it would trigger an allergic reaction from the patient when we administer this contrast media. Finally, because of the oversensitive nature of a CT scanner, there might be a possibility of overdiagnosis, which sound good, but imagine like you came to the imaging department just to check if you had why you have a stomach ache for this past week, and then suddenly the doctor found out that you actually have cancer or something like that, which will of course terrify a patient. That's it, and that's all from us. Thank you.